Hello guys, so now we shall be discussing regarding the muscles of the tongue. Okay, so we shall completely focus on what are the muscles we have got in the tongue region. So in the tongue region you have got many different muscles. For example, there are 8 different muscles that are located in the tongue region. Okay, so we divide these 8 different muscles into 2 groups. One group of muscle they support the tongue, and the other group of muscle are these muscles are located within the tongue. Okay, so tongue muscles are basically divided into 2 groups. What are these 2 groups? The first group are called as the intrinsic muscles. The first group are called as the intrinsic muscles. What are intrinsic muscles? Intrinsic muscles are located within the tongue. Extrinsic muscles are located outside the tongue. Okay, another one is called as the extrinsic muscles. Extrinsic muscles. So there are 2 groups of muscles over here. One you have got is the intrinsic muscles, and the next group of muscles over here are called as your extrinsic muscles. Now what do you mean by intrinsic as well as the extrinsic muscles? So first important thing is we will discuss about the extrinsic muscles. So how many extrinsic muscles you have got? You have got 4 extrinsic muscles. How many intrinsic muscles you have got? You have got 4 intrinsic muscles, right? So first of all, let us discuss about the extrinsic muscles. Extrinsic muscles. After that we will have our discussion about our intrinsic muscles. Now coming to this extrinsic muscles, what we'll do is that if we are cutting down, right, if we are cutting down this is called as a sagittal section. So in the sagittal section, right, when you are removing the right half, when you remove the right half and you are looking at this particular part, so that in that way you can see the extrinsic muscles. So if I have to draw the picture of that view, that is a sagittal section. So I do the sagittal section first. So in the sagittal section, if I had to look at those muscles, so what is the first thing I will see? Let us say I would see the tongue like this. This is the tongue, right? And second important thing is that I would also see the mental bone over here, right? So let us say that this particular part over here is called as your, and this is your teeth, right? So this is the tooth over here, clear? And this particular part is called as a mental spine or spine of the mandible. You can call it as a mental spine of mandible, mental spine of the mandible. And this particular thing over here is called as your tongue. So this is your tongue. And down here you have got another important thing. You see this? What is this? This is called as your hyoid bone. Okay, so this particular part over here is called as your hyoid bone. Okay, next you see in the front we have got the mental part, tongue we have got above that we have got the tongue, and down here we have got the hyoid bone. Now we will draw the structures on the back. On the back side you have here you have got temporal bone. Temporal bone is having a process called as styloid process, right? So let us say this is your temporal bone, and this temporal bone is having a bony projection like thing. This is called as your styloid process. And on the top here you have got your palate. So this is your palate. Let us say this is your soft palate. Okay, now let us draw the muscles within this box over here. So what are the different kinds of muscles? First important muscle over here is that from the styloid process into the lateral aspect of the tongue, from the styloid process like this into the lateral aspect of the tongue, right? So in this way you can see some muscles like this. You can see a muscle, right? So which is finally inserting to the lateral aspect of your tongue. So this particular muscle which you can see over here is what is called as styloglossus muscle. Why? Because from the styloid process it has started, so you call it as styloglossus. Okay, so this part over here, not to forget that this is your styloid process. This part over here is your styloid process. So this muscle over here you can call it as a styloglossus muscle. Styloglossus muscle. Okay. Next, all the way from the hyoid bone down, okay, all the way from the hyoid bone up to that styloglossus muscle, you see this one. From the hyoid bone to the styloglossus muscle, you see another muscle, right? You see another muscle that is present all the way from the hyoid bone to the styloid process, right? So this particular muscle which you can see over here is called as a hyoglossus because it started from the hyoid bone, right? I'm just drawing the muscles like that because, but we'll in detail we'll discuss about the origins also. So this is called as hypoglossus. It started from the hyoid part of the bone and entered into the lateral aspect of the tongue. Next, all the way from the mental spine. So this one was your mental spine. From the mental spine, the muscle is going and attaching to the lateral surface of the tongue on one side. It is going and attaching to the body of the hyoid bone on the other side. So this is your muscle like this. You see this particular muscle over here. Now what can you guess the name here, guys? What can you guess the name? So the name of this muscle is called as genoglossus muscle. Genoglossus muscle. And finally this one over here is called as your soft palate. Soft palate, right? So from the soft palate you see a muscle that is coming down into the tongue. So this is called as palatoglossus muscle because it is coming all the way from the soft palate. So this muscle over here is called as your palatoglossus muscle. Palatoglossus muscle. So important thing, what are the different kinds of muscles you have got? So first important muscle which you can see here is that one is called as styloglossus. Why styloglossus? Because it started all the way from the styloid process. Next you have got genoglossus, right? So all the way it started from the mental spine of the mandible and it is attached one side to the lateral aspect of the tongue and on the other side it is attached to the hyoid bone. Next, hypoglossus, it got originated all the way from the hyoid region. What is hyoid region? Hyoid region is nothing but your the hyoid bone here itself. Next, you have got another one called as a palate. So from the palatine region, you got a muscle that is attached all the way from the soft palate down here. So this is called as palatoglossus. Next important thing, so I think these are the different muscles. How many muscles we have discussed? 4 muscles. So these are the 4 muscles which are called as the extrinsic muscles. Right. So out of all these extrinsic muscles, about each and every muscle we shall discuss now. First is genoglossus. Okay. So where is the origin of genoglossus? Just look at it. The origin is from the mental spine of the mandible. So the origin is from the mental spine of mandible. Mental spine of mandible. Okay. Next, from here it originates, and where does it insert? It inserts to the entire length of the tongue, and not only that, it even inserts to the body of your hyoid bone. So after origin, where does it insert? Insertion. It inserts to the entire length of your tongue and also the body of the hyoid bone. Body of the hyoid bone. So this is the place where it is inserting. Okay. So this is the insertion point over here. What is this muscle? This is called as your genoglossus muscle. Now, so what is the action of this muscle? To know this action, when I have discussed muscles of mastication also, to know the action I have indicated arrows there. So here also what I will do is that I will indicate some arrows so that it would be easy for you to easily tell what are the actions of all these muscles. Okay. So first important thing is hypoglossus. Hypoglossus is a downward arrow and then a backward arrow. Genoglossus is a forward arrow, right? Next, styloglossus is again pulling the tongue back and then up. Okay. And after that we have got palatoglossus. Obviously by the picture itself it is up. Now you tell me in this genoglossus what will be the action. So the action is protrusion of tongue, in the sense putting your tongue outside, that is called protrusion of tongue. So that is done by the genoglossus. So genoglossus is what? Genoglossus action is, so the action of genoglossus would be protrusion of the tongue. Protrusion of your tongue, right. Second important muscle we shall be discussing is hypoglossus. Hypoglossus. Now, when it comes to hypoglossus, from where did it start? Hypoglossus started all the way from the hyoid bone and up it attached to the lateral aspect of the tongue. You see, this is called as your lateral aspect of the tongue, right? So, from the hyoid bone up to the lateral aspect of the tongue. So, origin. What is the origin? Origin is, it originated all the way from the hyoid bone. That is why you called it as hypoglossus. Hyoid bone to the lateral aspect of your tongue. Lateral aspect of your tongue. Now, what is the action of this muscle? What is the action of this hypoglossus? Just look at the picture over here. Hypoglossus has got two actions. One you can see over here is the depression, right, as well as the retraction of the tongue. So, tongue depression and then pulling the tongue back, that is hypoglossus. Okay, so two actions over here. One is called as the depression of the tongue and the other one is the retraction of the tongue, depression and retraction of the tongue. Okay, so these are the two actions of the hypoglossus. Now, after this hypoglossus, the next important one over here is your styloglossus. Styloglossus muscle. Okay. Now, when it comes to the styloglossus, where is this? See, this is the styloglossus. So, styloglossus originates from the styloid process of temporal bone. If you look at this particular picture, you can see the temporal bone. Where is the temporal bone? So, this part is your temporal bone, right? You see, temporal bone is having a small projection here down, right? This particular bony projection is nothing but called as, see, this particular bony projection is nothing but called as your styloid process. This is nothing but called as your styloid process. Okay. So, wait, what is styloglossus? Styloglossus started all the way from the styloid process. Styloid process of what? Of temporal bone. That is mastoid process, what you are thinking. Mastoid process is present for your mastoid bone. So, this is temporal bone. All the way it is inserted to what? Lateral aspect of the tongue. Lateral aspect of your tongue. Okay, let us look at the action of the styloglossus. See, styloglossus again, two important actions, retraction and elevation of the tongue, right? So, it is a retraction and elevation of the tongue. Retraction and elevation of the tongue. Next important muscle we shall be discussing is the palatoglossus muscle. The next important muscle over here is the palatoglossus muscle. From where does this palatoglossus muscle start? Where is the palatoglossus? This is the palatoglossus. So, palatoglossus starts from the palatine aponeurosis. So, here we have got the palatine aponeurosis. So, from the palatine aponeurosis all the way down to the lateral aspect of the tongue, we have got this palatoglossus. Okay. So, origin is from the palatine aponeurosis. So, palatine aponeurosis all the way till the lateral aspect of your tongue. So, this is what is called as your palatoglossus. If you look at the action, just look at the action of palatoglossus, you see the palatoglossus is pulling the tongue up. So, this is called as elevation of the tongue. So, what is the action? That is elevation of the tongue. Elevation of the tongue. Now, tongue, but which part of the tongue? See, if this is the entire tongue, so palatoglossus is present on the back. So, can I call it as a posterior tongue? So, elevation of the posterior tongue. Posterior tongue. Okay. right. Now what is the nerve supply? First of all, let us write down the muscles. So one we discussed was gynoglossus, right. Next we discussed was hypoglossus. Next we discussed was styloglossus, and next we discussed is the palatoglossus. So these are the four muscles. Now out of these four muscles, the first three muscles what you can see like gynoglossus, hypoglossus and styloglossus, they are innervated by a motor nerve, and that is what is called as your hypoglossal nerve. Okay. Next, after that you got the palatoglossus. Palatoglossus alone is innervated by vagus nerve. So two nerves that are innervating your tongue, extrinsic muscles mainly. So what are these muscles over here? What are these nerves over here? One you call it as the hypoglossal nerve, another one is vagus nerve. Vagus nerve to what? Palatoglossus muscle. And to the remaining three of them like gynoglossus, hypoglossus and styloglossus, you have got your hypoglossal nerve. Now what we shall do is that, so these muscles which you have seen over here, these muscles are considered as a extrinsic muscles. Now what we shall do is that we shall discuss what are the list of intrinsic muscles. Okay, let us see what are the list of the intrinsic muscles over here. Now if I have to draw the intrinsic muscles, I have to cut in a cross section, right, or coronal section. So when I cut down the face like this, you can see two teeth and the cut portion of the tongue, right. So if this is the tongue, if I am cutting down the tongue, you can see the muscles inside, right. So let us look at that section now. Right. So this is the cut portion of the tongue, and down here you have got your hyoid bone. This is your hyoid bone over here, right? And this is the teeth, right? So what I am doing is that let me draw a midline over here. Right? You know what is this midline? This is called as median fibrous septum. So this midline over here is called as the median fibrous septum. And by the way, what are the muscles which we shall be discussing right now? We will discuss about the intrinsic muscles. We will right now discuss about the intrinsic muscles. Now here in this cut section, what are the different kinds of muscles you can see? First important, on the top here you can see this group of muscle here on both the sides, right? So this group of muscle which you can see on both the sides is called as longitudinal muscle. As it is on the top, you call this muscle as superior longitudinal muscle. Okay, you call this particular muscle as superior longitudinal muscle. After this superior longitudinal muscle, you have got one more muscle down here, and the fibers of these muscle are vertical. Okay, the fibers of these muscle are vertical. So this group of muscle fibers are called as vertical muscles. After the vertical muscles, down here again you have got that the same group of muscle fibers here, okay, which are also longitudinal. So these group of muscle fibers or nerve fibers which you can see, which are longitudinal located down, right, which are longitudinal and located down, these are called as transverse muscles, right. So three groups of muscles over here. What are those three groups of muscles? One we have got is a longitudinal muscles that are called as superior longitudinal muscles. Next we have got vertical muscles. Next we have got transverse muscles, and down here again you have got a group of muscles, if you can see. So these group of muscles are similarly looking like the group of muscles which we first draw, right? So the muscles which we have first drawn there on the top, the same group of muscles are these. So they are called as superior longitudinal muscles, and this is called as the inferior longitudinal muscles. Okay. So how many muscles total? We have got the 4 muscles over here. So what are these 4 muscles? See, this is one muscle, this is the second muscle, this is the third, and this is the fourth muscle. Okay. So let us see what are these muscles. So the names of these muscles are, the first muscle is called as a superior longitudinal muscle. Next we have got is the vertical muscle. Next we have got here is the transverse muscle. Next down here we have got is the inferior longitudinal muscle. So there are 4 groups of muscles: superior longitudinal, inferior longitudinal, vertical, and transverse. So these are the 4 groups of muscles which we have got. First of all, let us write it down. So 4 groups of muscles are there. One is called as a superior longitudinal muscle. Next we have got the vertical muscle. Next we have got the inferior longitudinal muscle. Next we have got what? Superior longitudinal, inferior longitudinal, and transverse muscle. We have got the transverse muscle. So these are the 4 muscles. And one more important thing is that along with these muscles, you can also look at the extrinsic muscles also. But not all extrinsic muscles, you can only look at few extrinsic muscles. For example, you see on this side over here, you can see a small extrinsic muscle on both the sides. So this small extrinsic muscle on both the sides is called as styloglossus. Okay, so this small extrinsic muscle on both the sides is called styloglossus. In the same way, you can also see a small muscle which is located all the way here. Okay, so this muscle which you can see all the way here is what is called as genoglossus muscle. You see this muscle? This muscle over here is called as your genoglossus muscle. So this muscle over here is your genoglossus muscle. On the side of the genoglossus muscle, you have got another group of muscle like this. This is called as the hypoglossus because it is attached where? It is attached to the hyoid bone, right? So it is called as hypoglossus. So let us name these muscles right now. So this particular muscle, second as well as the third muscle. So what is the first muscle name? The first muscle name is what is called as your styloglossus. Next you have got is the genoglossus, and the last one you have got is a hypoglossus. So these are the group of muscles that are located over here. Okay, right. Next important thing. The next important thing is that let us see what is the sensory supply of the tongue. So if you wanted to know the sensory supply of the tongue, you just have to divide the tongue into 2 portions. So these are the portions. So what are these 2 portions? This is called as a posterior 1/3 of the tongue, and this is called as an anterior 2/3 of the tongue. So you divide the tongue into posterior 1/3 and anterior 2/3. Now in the posterior 1/3, the sensations, right, the sensory information, not only the sensory impulse, along with that the taste, right, sensory and taste fibers are carried out by glossopharyngeal nerve. So in the posterior 1/3, the sensory information as well as the taste is carried out by the glossopharyngeal nerve. What is glossopharyngeal nerve? Your 9th pair of cranial nerve. Glossopharyngeal nerve. Okay, so it is carrying what? It is carrying both the sensations as well as the taste. Next, down here if you come, there are 2 different nerves. For example, for sensations you have got a different nerve, and for taste you have got a different nerve. For example, for taste you have got a nerve called as facial nerve. And next, for the sensations you have got trigeminal nerve. So which branch of trigeminal nerve? Trigeminal nerve has got 3 branches, V1, V2 and V3. What is the V3 branch called as? Mandibular branch, right? So this is your trigeminal nerve is your fifth pair of cranial nerve, right? So this fifth pair of cranial nerve is having three branches. What are those three branches? V1, V2 and V3. V3 is what? Mandibular nerve. Mandibular nerve. And this mandibular nerve gives rise to a branch, and that branch is called as the lingual branch. Lingual branch. So that lingual branch is carrying out the sensations. So it is the lingual branch. Lingual branch of what? Lingual branch of your mandibular nerve. Lingual branch of your mandibular nerve, right? So let us discuss all the important things so far, whatever we have just discussed right now. So we started our discussion with the tongue muscles. We discussed that there are intrinsic as well as extrinsic muscles, 4 intrinsic and 4 extrinsic. 4 extrinsic muscles we can better see on the sagittal section. All the way from the soft palate down till the lateral aspect of the tongue, this is called as a palatoglossus. After that, from the styloid process of the temporal bone into the lateral aspect of the tongue, this is called as the styloglossus. Next, from the hyoid bone up, you got a muscle called as hyoglossus, and from the mental spine of the mandible, you have got a muscle called as genoglossus. So by looking at it, the actions are also discussed here. First, palatoglossus action is elevation of the soft palate, the tongue. Next, styloglossus action is a retraction of the tongue and elevation of the tongue. Hyoglossus action is depression of the tongue and retraction of the tongue. And genoglossus is the only muscle that is responsible for the protraction of the tongue, that is putting the tongue outside. So we discussed the origins and insertions over here, and important thing is all these muscles are innervated by hypoglossal except the palatoglossal, which is innervated by the vagus, right? So here we can also look at some other muscles. These are called as the intrinsic muscles. How many? 4. Superior longitudinal is one muscle, vertical is another muscle, transverse is another muscle, inferior longitudinal is another muscle. So completely 4 muscles. Next important thing, this is the nerve supply over here, right? So these are all the important things which you need to know regarding the tongue. So thank you so much for watching my video. Goodbye.